Tom. I'm a clinical psychologist. I've been working with people and their families for nearly 20 years. I have seen firsthand how depression can pull men under, often without realizing what's happening. Because I've lived a lot too, I felt the weight of it, that dull grey that creeps into every corner of your mind, convincing you that you're weak, you should just toughen up. Depression doesn't care if you're strong, successful, or if you've got people who love you. But let's be clear, it's an illness, it's not failing. Depression feels heavy for absolutely no reason. Small tasks can feel impossible. It's hard to remember the last time you genuinely enjoyed anything. It doesn't have to be sadness either. Sometimes it's like a complete lack of feeling anything. It lies to you, tells you you're alone, that you're weak and that you're incapable. Sometimes the hardest part is recognizing this isn't a rough patch. It's an illness. It's not about being weak or strong, it's about being treated. So first of all, it's not about having a bad day, yeah? I mean, we all get those. But with depression, it's when it starts sticking around. And there are a whole bunch of symptoms, and they start to work as a team. They start kind of working, bouncing off each other. We're talking symptoms like, obviously, your mood's down, but you can get agitated, your concentration goes, your sleep, your appetite. Thing is, once they start working together as a team, they're like a snowball. They kind of build up. So, for instance, let's say, I don't know, your dog dies. Horrible. They're a family member, right? And that kind of brings you down. It should bring you down. So a couple of days, a couple of weeks, you feel pretty sad. Every time you kind of go to feed the dog and it's not there, you feel like crap. You should. But then it starts affecting your sleep and you get tired and you go to work and you screw up a few times. You get a document wrong or you can't concentrate on your emails and it builds up and you feel embarrassed, but you're not telling anyone there because you don't want them to see you as weak at work. So all these things start to build up and that sadness you had, weirdly enough, starts to feel a bit more like flatness. And it's disconcerting. You start to kind of wonder what the hell is this emotion? It's kind of numb. So all this builds up and that snowball's kind of got a whole bunch of inertia. And by the end of it, you start looking at yourself and you can't kind of feel a way out of it. You're stuck. You're hopeless. It's a dangerous place to be in, which is why you need to reach out, why you need to kind of get treatment, because that's not just a crummy day, that's actually now depression. Well, you use psychotherapy. A psychologist, trained psychologist uses psychotherapy. It's a nerdy term, isn't it? Psychotherapy. What it really means is you just sort of chat, but in a really specific way. You look for ways to call depression's bluff. You look for the reasons that depression is really happening, because 99 times out of 100, the person that's sitting opposite me thinks they know what it is. They're sure it's them. They're broken. They've got a problem. And that is not the case. Depression is because they've felt sad for a legitimate reason, and then it continued. And then they lost sight of it, and they started blaming themselves. So in psychotherapy, we help people realize that it's not their fault. Number one, they stop judging themselves. Number two, they start looking at it from the side so they can actually treat it objectively themselves. I mean, one of the most important things I do is I become redundant. I teach people how to do it themselves. Well, like I said, the meanest part of it is you judge yourself, and that because of that, you lie to yourself. You say that you can't, that you're stuck and it's hopeless. I mean, it's just not true. So the first thing you should do is realize that having depression means you are definitely lying to yourself. You're judging yourself. You're not weak. You've just forgotten how to solve the problem. Yeah. Then reach out. Reach out. I want to be able to talk to you. I really do. Because I know how to kind of get behind it and attack it and get rid of it. Help you do it, same thing. So go to a GP. GPs are kind of the hub for all of this in Australia. So when you go to a GP, they might ask you a few questions. They may not get too into it if you don't want them to. That's totally cool. They're pretty good like that. But then they'll give you a mental health care plan. That gives you access to psychologists. That's hard, man. Like, it sucks seeing your family or your mates feeling down. But it's also really awkward. I mean, I still find it awkward. I'm a psychologist. I've been doing it for almost 20 years, yeah. I still find it awkward going up to a friend of mine and going, hey, are you all right? Like, really, are you all right? Right? Feels weird. So the first thing is you have to be awkward. But please don't sit there just watching it. You have to kind of commit to yourself that you're going to talk to that person about it, no matter what. I'd say, I'm a bit worried about you, man. You seem a bit different. You seem off. Like, normally the guy is talking around the office, but actually you're pretty quiet. And then you're doing all right. Tricky thing is in Australia, how many people, like I do, if someone asked me and I'm having a crummy day, I would go, fine. So are you okay day, I think, should be called are you okay times 2. You got to go, you all right? No, you're actually all right. So the goal here is to be able to get that person to kind of open up and to realize that they can do something about it. So what's really important is you just get all that judgment you've got and you kind of throw it out the window and you just open. Just listen. Let them go through the story if they need to. Let them put up some resistance if they need to. But you stand your ground. It's all right, man. I'm still going to care about you. It doesn't matter what you do. If you think about the end goal is to get that person treated. If they've got a cut, you want them to put a Band-Aid on it, right? So it's all very well them kind of opening up to you, but it's so important that at the end of that, there's a Band-Aid. And in this case, it's your GP and then a mental health care plan, and then it's having a chat to a strange person like myself, you know? One of the important things that I tell all of my clients is that if it's not working out for them, or they felt a bit awkward there and they was thinking, I don't know if I'll turn up next week. That's normal stuff, right? Well, you'd do that if you had a difficult experience with your plumber or the guy at the milk bar. In this particular case, though, you got to kind of stand your ground in trying to get your treatment. So if you don't get along with the psych, I always get my clients to tell me that it's just not kind of working. It's really important that you keep looking when you're injured. So of course it's important to keep looking when you've got depression. And the thing is, it doesn't always take a psychologist. Maybe it'll be a social worker, maybe it'll be a counsellor. Maybe it's talking to your mates, but your mates need to kind of steer you towards medical help if it's a medical problem. And depression, I'm afraid, it's an injury, and that needs medical help. Whatever you do, though, do not give up, because it's important that you get treated.